While regional officials have indicated that the deadly coronavirus may not reach the Caribbean, representatives of Grenada's Ministry of Health say a contingency plan is in place to ensure the island and the population are protected. Chief Medical Officer Dr. Francis Martin says quarantine of people suspected to be carrying the disease has always been under consideration, and officials are prepared to take that measure if there is a need.
We have a number of different contingencies because you don't really know exactly what's going to happen. But what's for sure is that we have quarantine facilities at the airport. That is temporary, and then there are a number of different options that we have on the table for if something untoward is to happen on the island. The options we have is not just quarantine for 1 or 2 persons, but in the unlikely event that there is mass quarantine that needs to take place, then we also have a contingency plan in place for that. But as you can imagine, it's a new virus, and because it's a new virus, the world of science hasn't developed a vaccine or treatment for it yet. So it's basically supportive treatment.
What about the hospital?
That's part of the contingency plan, in terms of having an area allocated for quarantine if we need to, or isolation if we need to have isolation.
So it's already been identified at the hospital?
Yes.
According to the World Health Organization, this new strain of coronavirus is of a large family of viruses that cause illnesses ranging from the common cold to more severe diseases such as MERS and SARS, and was first confirmed by authorities in the central Chinese city of Wuhan earlier this month. Up to midday Wednesday, the virus had claimed the lives of 132 people in China and infected close to 6,000 in more than a dozen countries. Ambassador Zhao assured Prime Minister Mitchell that a multiplicity of measures is being explored to prevent the further spread of the coronavirus. He highlighted the lockdown that was instituted, saying the residents of Wuhan are not allowed to leave. Speaking specifically about the Grenadian students in Wuhan, he said it is not recommended that they evacuate. Dr. Martin agrees.
While local authorities have been saying that they've been doing what they can to ensure the children are safe, the students themselves are saying that they are not safe. I heard one report of a student saying her roommate, who is not Grenadian, keeps going out and coming back, and she was in danger. There was another one that's saying supplies were low and they haven't had much contact with authorities in China as it relates to their safety, and there are others that saying they have not heard directly from Grenadian authorities in terms of ensuring that they are safe.
I don't know if you're asking whether or not we should, evacuate those students and bring them home. I'm not so sure if that's what you're alluding to.
That could be is that an option, I should say?
But if the feeling is that everybody in China has the virus, why would you bring them home?
The Caribbean Public Health Agency has recommended that member states be proactive and vigilant, adding that they must reinforce surveillance measures at points of entry, communication strategies which emphasize good hygiene practices, and measures targeted at reducing the importation of this new virus to the region. Blossom Alexis Welsh, GBN News.